My name is Sun Yanbin, come from the First Hospital of China Medical University, the Department of Thoracic Surgery. Today we will talk about thoracic empyema. First, I will ask you a question. What is the goal of empyema therapy? Is it prolongation of life? Is it to control the symptoms? Or is palliation or beyond the cure? I hope you can answer me after our class. So what is the thoracic empyema? The definition is the accumulation of pus within the pleural cavity. The pus is usually thick, creamy, and malodorous. Here is the picture of pus. You can see thick, creamy, and malodorous. So thoracic empyema is characterized by the presence of pus or microorganism in the pleural fluid. So follows infection of the structures surrounding the pleural space, including subdiaphragmatic structures. So empyema is caused by an infection of the structures surrounding the pleural space. And this is the key point you should remember. The most common cause is bacterial pneumonia. And other risk factors include lung abscess, thoracic surgery, trauma to the chest, thoracentesis, and subdiaphragmatic infections. Staphylococcus aureus is the most common pathogen. It's also another key point you should remember. And streptococcus pneumonia is less common, but it produces a large pleural effusion that progresses rapidly to produce empyema and sepsis. Here is the picture of fungus, another pathogen of empyema, just like a beautiful flower. And the tuberculosis is real, occurring only about 2%. And the tuberculosis is capable of causing infections throughout the body, but the most common location is the lung. So there are three pathways of pathogen into pleural cavity. The first is direct involvement, such as pneumonia, lung abscess. The second is lymphatic drainage, such as liver abscess, subphrenic abscess. And the third is bloodstream, such as sepsis. So empyema are divided into three phases based on their natural history. The first is exudative phase, is early and acute. And the second is fibrinopurulent phase, is late and transitional. The third is fibrinogenic phase, is chronic and organizing. The first, exudative phase, is also called acute phase. In the right side X-ray, you can see a large amount of fluid in the space. And the second is fibrinopurulent phase, is also called transitional phase. The third is organizing phase, is also called chronic phase. So the empyema common symptoms include chills, fever, dyspnea, chest pain or referred pain, night sweat, cough, increased sputum production. And the chest X-ray is the primary investigation for the patient. The CT scan usually differentiates empyema from the consolidation and the lung abscess. In the tuberculosis, CT scan shows a thick calcific ring and rib thickening surrounding located pleural fluid. So the ultrasound scan used to confirm presence of fluid in the pleural space. So here is the thoracentesis. It's diagnostic and treatment procedure done in the patients who have abnormal amounts of fluid accumulation in the pleural space. Treatment for acute empyema has three core principles. This is very important. You should remember. The first, promote initiation of appropriate antibiotics according to the drug sensitivity of pathogen. The second is complete evacuation of suppurative pleural fluid. The third is preservation or restoration of lung expansion. Here is the chest tube insertion drainage. The drainage will keep until the empyema space is totally obliterated and healed. Here is the procedure for the chest tube placement and the treatment for acute empyema. The cure criteria include the pus drained entirely, the residual cavity vanished, and the lung was fully re-expanded. The treatment for chronic empyema also has 3 core principles. It's also very important. The first, to improve the patient's general conditions, to correct chronic toxic symptoms and malnutrition. The second, to eliminate the primary chronic causes. And the third, to obliterate purulent space, restore lung expansion and pulmonary function. And last, we will have a test. Please answer me, what are the principles of treatment for acute and chronic empyema? That's all. Thank you.